Good afternoon, it's Tess Crawley again. How are you today? I have been inspired a little bit to comment on a post I made on our Hobart Perinatal Psychology page very late last night when I really should have been asleep. Larissa Waters, the Greens Senator, obviously I'm assuming you may have seen in the news that there's been lots of media attention around her breastfeeding while delivering a speech in the Senate. And I thought it might be interesting to discuss why it is that psychologists care about things like breastfeeding. What does that have to do with a psychologist? Well, it has a little bit to do with an area of psychology called infant mental health, but also perinatal mental health. And they might be terms that you have come across before, or they might be terms that you've never heard before. So I thought if we talk a little bit about what that means. So perinatal psychology refers to that time when, it depends who you ask. Some people talk about it referring to birth to the first year of age for the baby. So postnatal is what they're really talking to there. Some people include conception through to the first year of the baby's age. We tend to think about, in my practice and a lot of other practices also, tend to consider from the time that you're considering having a baby right through to 3 years of age as being the perinatal period. So it includes then areas like infertility, birth, attachment, birth trauma, miscarriage, breastfeeding comes into it, of course. Although we're not lactation consultants, we won't teach you how to breastfeed your baby, but we understand that issues to do with parents' expectations around whether or not they are planning to breastfeed, how they feel about whether or not they're able to breastfeed, how they feel about the pressures that they're under, whether they choose to breastfeed or not. A lot of mums talk to me about this sense that they can't win. They're either breastfeeding in public and feeling criticised, or they're bottle feeding in public and feeling criticised, and that there's this great sense that they just can't win no matter what option they choose, and that why should it be that babies need to be fed one way or another behind closed doors. So this is kind of the area that Larissa Waters' speech while breastfeeding speaks to for me as a psychologist. It's really important that as a society we look to as many ways as we can to encourage that mums and dads should feel as comfortable as possible feeding their baby in whatever way they choose. So I've wobbled the table, sorry. So if mum is choosing to breastfeed exclusively, or if mum is choosing to bottle feed exclusively, if mum is expressing and dad is bottle feeding, any option, formula feeding, any option that is putting bub's care at the forefront of parents' mind is of course a valid thing. Why else do psychologists care about breastfeeding? We care because we care about the infant's mental health. So are we talking about depression, anxiety, sort of, but we're talking also about attachment. And attachment is how secure a baby feels in their new world outside of the womb. How do they feel about this environment around them? How do they feel about the responsiveness of their parents to addressing their needs? And so, of course, a baby's very first need is to be fed. So how are we responding to that baby's need to be fed? Are we responding with a you have to wait because I'm giving a speech in the Senate? Or are we responding with a you're hungry, I can breastfeed you immediately, what's the problem? So babies learn really quickly that their environment is safe, is nurturing, is predictable, based in those very, very early days on how responsive we are to their needs. So there are lots of myths, lots of old tales, if you like, around creating rods for our own backs. And that's an area that we really try to work gently with mums and dads around coming up with their own comfort zones around what's right, what's appropriate, and what's responsive for their baby. And we teach parents strategies for being able to interpret what their baby's trying to tell them. So there's lots and lots more that I could tell you about perinatal and infant mental health, but I thought that on the back of that post last night about Larissa Waters, it would be really nice to just explain to you why it is that psychologists care about things like breastfeeding. whether that be in public or not. Have a great afternoon. It's Saturday, so enjoy the rest of your weekend, and I'll talk to you soon. Bye-bye.